Mr. President, I'm here today to speak on legislation that we voted for cloture on last night, the Medicare Physicians Fairness Act. I'm here to really express my disappointment and frustration that we did not vote through a parliamentary procedure so we could debate the issue of what is facing physicians who provide Medicare treatment to Medicare patients. Under the current situation, American doctors will face a 21.5% payment reduction, what they get from Medicare when they treat Medicare patients. I think this is really outrageous. You know, right now we've got people who took TARP money and they're acting like twerps. What they did is they take the money, they don't lend the money, but they sure give themselves money with lavish compensation and bonuses. At the same time, every single day, 24/7, there are doctors on the front line saving lives, improving lives, and having people count on them. I'm very sorry that they chose over a budget debate to vote to take it out on doctors. We've got to treat our doctors fairly for what they do and the sacrifices they make to do the job they do. This 21.5% payment reduction, imagine that. Well, imagine if we had to take a 21% pay cut. Do you think we would have voted for cloture? I don't think so. We're now forcing doctors maybe to close their doors to seniors, denying people access to the doctors that they need and that the doctors that they should have. We cannot let this happen. Every day we ask the doctors treating our Medicare population to be unstinting in what they do. But then when it turns around, the government is stingy. I think that's a double standard. We ask the people who provide the hands-on service to be unstinting, and yet when it comes to paying them for what they do, we're pretty stingy. This is unacceptable. As I said, we ask so much of our doctors. What is it? They need to be skilled. They need to be smart. They need to be empathetic. They need to be available 24/7. We ask them to have the scientific understanding of a Nobel Prize winner and the patience and compassion of Mother Teresa. Our doctors assume tremendous responsibility for life, the risk and accountability for making the right diagnosis, the right treatment, tailored for each unique patient. They follow us all the way through when something happens to us or comes up in our lives. Our doctors look out for the aging population in our country. People who get older have multiple problems, and sometimes the very treatments contradict each other, requiring tremendous scientific skill and collaboration. When you treat older people, they need to take time to tell their story, to tell the narrative. They don't go in just with a list of complaints. I've heard my Medicare constituents say time and time and time again, I don't know what I would do without my doctor. Our doctors are always there for us, but are we there for our doctors? Look at what they face. First of all, in many instances, they're the first responders. They're there when they're dealing with disease, trauma, and even death. For all the work they do while they're trying to work with their patients, they have to face a healthcare bureaucracy, public and private. What is the one thing the public program and the private programs have in common? They have a bureaucracy. Doctors tell me that when they came in medicine, it was to make a difference in patients' lives. What do they run into? Hassle factors, complicated administrative forms, pre-approvals, and then skimpy and Spartan reimbursements, whether it's from private insurance or Medicare. We need to face up to this country, and we need to start focusing on value care, not volume care. Patients are grateful to their doctors, but Medicare reimbursement is not. For all this work and this training, it is not rewarded for what doctors have to do. They have to work with a whole team, nurses, social workers, pharmacists, integrative health professionals. One of the things we should do is to make sure they're paid fairly. For health professionals and that entire team I talked about, their career is their calling. Mr. President, I want to share a personal anecdote with you and why I feel so strongly about this. Not only because I chair the subcommittee on aging, not only because I've tried to be a champion for the older population throughout my public career, but in July, I took a fall coming out of church after Mass. I broke my ankle in 3 places on a Sunday afternoon. I was in absolute shock. And as I tried to figure out what I would do, and some of the people from church came to my rescue and sat down, I was able to contact my primary care doctor, and I had an ambulance pretty quick, and I was taken to a downtown urban hospital, Mercy Hospital. And it is truly, in every way, exemplifies the quality of mercy that droppeth like a gentle, that comes like a gentle drop. Now, on my way there, and what happened to me is I went into the ER, that's emergency room. It was like what you see in TV, only this was no miniseries. This was real life. At the hospital, the doctors talked to me, and I spent time working with them as they treated me, got me through what I needed to do. I was met by the ER doc. They had to take x-rays. There was the radiologist. There was my primary care doctor on the phone, because Mercy is my medical home. A gifted and talented surgeon left his family at a cookout because the call of duty came and he raced to be there. Was it what was for Senator Barb? No. It's because the other people in the ER, they were doing the same thing for everybody. The ER doc, the radiologist doc. Then as I waited a few days for the swelling to go down, then I had surgery. That involved the anesthesiologist. I could go on and on. When I look at all of the doctors that cared for me that day and the subsequent weeks, the ER doc, the radiologist, the anesthesiologist, the orthopedic surgeon, my primary care doc, my cardiologist. Who were these? First of all, they were wonderful people at my side. But they were people who had graduated from college. They were people who had gone to medical school at considerable stress and cost. They had gone through sophisticated residency programs and some even postdoc fellowships. And they also participate in ongoing continual medical education that's required. And they do it not because it's required, but because they want to be tops at the field. Well, for all of that work, and then the responsibility that they assumed, we have to be able to reimburse them. You know, Mr. President, I've seen the healthcare system from the wheelchair up. I've seen people who provide the healthcare, and I've been in rooms getting physical therapy with the others who also need care. And one of the things that they're absolutely clear about is that we need to look out for the people who take care of us as they look out for us. So today I'm asking that we recognize the doctors for all that we ask for them, the knowledge they need, the risk they undertake, the high cost of their education, and spending 12 years of training, being on call 24/7, often rushed from their families when they want to spend time with them. I ask that we recognize those doctors by compensating them justly and fairly and not treating them like a commodity. We also need to do that for the nurses, the social workers, the physical and occupational therapists, the integrative health people, all of those in the team. So today I say if we don't pass this Medicare Physicians Fairness Act, we've got real problems. Failing to pass this bill is not an option. Mr. President, I really think we need to do the right thing by the doctors, and I think we need to do a right thing by the people who need the doctors. Let's just do the right thing and pass the Medicare Payment Fairness Act.